Oh, good evening, good morning, good afternoon, wherever you are. It's good to be with you. This is a discussion around the disease Mpox. And Maria, I wonder if you can put our slide up for us, please. I'm Michael Moore. I'm the chair of the International Task Force on Immunisation Policy for the World Federation of Public Health Association. And what I wanted to do this evening was have a discussion with Dr. Jean-Marie Okwabele to try and understand what it is about Mpox and how does it work. So let me tell you about our guest, Dr. Okwabele. He's a former director of the Department of Vaccines and Immunisation at the WHO in Geneva, but he now holds a senior strategic advisor position to the Director General of the African Centre for Disease Control. And he serves on a board of directors for the International Vaccine Institute. He's a member of Strategic Advisory Board of the Pasteur Network. He's chaired the WHO Emergency Committee, addressing the multi-country outbreak of Mpox in 22-23, and continues to serve on the current Mpox Emergency Committee. He has an extraordinary background, and I won't go into it all because we want to focus on this particular issue. Dr. Jean-Marie Okwabele is a medical doctor with a master's in public health. Can we start, Jean-Marie, by telling us why we now start calling it Mpox and we're not talking about monkeypox? We were always talking about monkeypox not so long ago.
Good morning from Geneva, Michael. Good morning to everyone. Good evening. What I could add to the nice presentation you made about myself is that I started my career actually in the DRC, my country of origin, where I worked for a WHO surveillance study that was looking at monkeypox at that time. And it was about understanding the natural history of that emerging zoonotic disease in order to determine whether that disease would be a threat to the just completed smallpox eradication. So we're talking about the 1980s. That's when I got started in my career in public health. So to answer your question, the disease, the virus was actually discovered in monkeys that were in captivity in Sweden in 1958, and the human cases were detected first in the DRC in 1970. So WHO modified the name recently to indicate that the monkeypox virus causes a disease that will then be called Mpox, because actually monkeys get the disease as humans would get the disease. They're not the reservoir of the virus. So that's to make it very clear that this is about a virus that infects monkeys, that infects other primate animals and humans.
I wanted to ask you about transmission and how it goes. In a recent Lancet article, actually just from September 10th, they were talking about the extent, and we'll come back to that, but they're also talking about modes of transmission. In that article, we did mention particularly men who have sex with men and a range of others. So can you put in perspective how this virus is transmitted? And then we'll get on to just how serious the situation is at the moment.
Well, Michael, your question leads to the fact that we are now facing a complex situation. When we looked at the disease, some 40 years back, we were talking about based in Congo clade of monkeypox, and West African clade of monkeypox. Then they were renamed as clade 1 for the Central African clade, and then clade 2 for West African virus, because there is a bit of difference, including in the severity. Now, what we've seen as time went by in the past decades, there were sporadic cases in Africa, linked to the zoonotic nature of the disease, obviously, and affecting mainly, people living in villages, remote areas, and so on and so forth. But in 2022, it was this massive transmission across the world, more than 100,000 cases in 116 countries, according to WHO. And countries that never had cases of Mpox before. So, and that transmission, international transmission, was linked to the West African clade out of Nigeria, and that clade was named clade 2B, to differentiate it from the clade that is transmitted within Nigeria and other West African countries, as part of the zoonotic transmission. The one being transmitted internationally was obviously transmitted from human to human, and mostly in some communities of men having sex with men.
So is it like HIV, bloodborne transmission, or is it, and I think I read that sometimes it's just skin to skin is the main form of transmission?
Exactly. So that's where on one end we can be clear, sure, that it's about skin to skin, close contact transmission. Now, this type of transmission can happen within household, but also within, for instance, health facilities, with health workers, being exposed to with people who are infected, but we also see transmission through sexual contact. We're not saying that it's sexually transmitted, but we're saying that the closeness of sexual rapport, that's what also facilitate transmission. So it's mainly skin to skin, close contact mode of transmission. Outside the transmission, which is not well understood, the zoonotic one, which animals transmit to humans. We don't know which one. People are talking about some rodents as being the reservoir, but that's part of the studies to be done. It has been neglected, that aspect. That's why we continue to see the upsurge of the cases in Africa, where the disease is endemic.
So the Director General of the World Health Organization in 2022 declared an emergency of international concern. I think I'm using the word public health emergency of international concern. And now again they've declared it, but I think we have many, many more cases now than we did then, if I'm not mistaken.
So the first declaration back in 2022 was linked to these, international spread. It was scary to see that, so many countries could be indeed affected by the disease, and getting to more than 100,000 cases. That was worrisome. And the fact that this was due to a new clade 2B.
Yes.
Now, with the declaration of Mpox as a public health event of international concern, countries were alerted, and many of them got involved in ensuring that the disease can be controlled, and that happened almost 1 year later due to massive, great engagement of the communities, that were affected,
Yeah.
they themselves did a lot in terms of changing their behaviors. But also the use of vaccines in some of the countries in the north, in Europe and in the US and Canada and others, brought the outbreak to control internationally. But in Africa, the situation didn't change. Because the way no investment actually in ensuring that there are control measures in place. I must say that governments as well as the international community have not paid much attention to the disease, the infections transmitted down there. And we saw this year, in particular to 2024, an upsurge of cases linked both to the zoonotic transmission part and to the emergence of a new clade
Yeah.
1B, like to the 2B that went internationally, but this time is 1B detected in the eastern part of Congo early this year, 2024, and which spread is quite rapid. And it has infected many regions in the eastern Congo, but also Eastern African countries that never reported Mpox, like Rwanda, Burundi, Kenya, and Uganda. So, and we saw also cases reported out of Sweden and Thailand of that clade. And remember that I said that clade is a little more severe than the previous one that we had. So there are reasons truly why not only Africa CDC had to move forward and declare this as a public health threat of continental security. No, that's the mandate that they have to do that. But also a week later or so, WHO recognized that this was also quite important and determined that this should constitute a PHEIC, a public health event of international concern. And there we are. Those declarations now are prompting actions, including in Africa, especially in Africa, I mean.
Yeah. So tell me about, you mentioned vaccination, and I wonder how widespread the vaccine is, how effective it is, and what chance are there of ensuring that it gets to where it's needed most in Africa, as opposed to being used in developing countries. Always a problem, as you well know, and not just with this vaccine.
Yes, Michael, another important point. So a lot to be talked about there. First, to recognize that the Mpox vaccines are actually smallpox vaccines.
Okay.
So the smallpox vaccines that were used during the campaign to eradicate smallpox are considered as first generation smallpox vaccine, first generation. Then when the smallpox eradication was achieved, there was a need to keep an emergency stockpile of smallpox vaccine because, you never know what might happen.
Yes.
And while doing this, I think there were a great idea of improving the safety of these first generation vaccine because there were quite some side effects with the first generation vaccine. So we had second generation vaccine. One of them is available today. It's called ACAM 2000. It's made in the US. Then we had further attenuation of the live vaccinia virus that is used to make the smallpox vaccine. And now we have third generation vaccine, two of them, one made by Bavarian Nordic in Denmark, and another one by a Japanese company. It's called LC16. So those two vaccines provide cross protection against Mpox, because it was observed, and we did see this in the DRC 40 years ago, that people who were vaccinated against smallpox would not be at risk of having Mpox. So
right.
even now, most of the cases are occurring in persons that are less than 40 years, because those above that age,
Yeah,
like ourselves,
we're all vaccinated
exactly
for
against
smallpox. Yeah,
the pox
yeah,
viruses, if I may say so.
yeah.
So that's why most of the cases are in children and in kind of young adult, if I may say
Young
so.
adult. Yeah, yeah,
So we have two vaccines, and the most available one is the Bavarian Nordic vaccine that it has been made available to the DRC for the first time in Africa just last weekend.
Oh wow,
So,
it's taken a long time, hasn't it?
well,
Yeah.
talk
At least
about it
it's happening.
and
At
so on.
least it's
But
happening.
well, one of the reasons, Michael, is that the affordability was not there. It's you need two doses for effective protection, and the cost would be close to 200 euros. Between 150 to 200 euros.
Yeah,
So it's quite some money.
yeah,
And obviously, given the competing priorities in Africa, African
yeah,
countries could afford this. So the DRC got a donation thanks to the US, thanks to European Union, and thanks to Bavarian Nordic company itself. So they got 200,000 doses, which will now be used to control disease. But the tricky part
and
is how
targeted.
to
I
use it.
presume targeted in particular areas. Yeah, yeah,
That you use the great point, targeted approach. That's so it's an outbreak response. So you have to have a targeted approach, because we cannot use it in a campaign mode. First, we don't have enough
it's
doses.
not
Second,
like polio. Yeah, yeah,
we to control the outbreak so that it doesn't spread further, we have to have a targeted approach. And so the some of the lessons from the Ebola vaccination that was used to contain Ebola outbreaks, some of those lessons are helping now. So
yeah,
we're doing in the DRC what what we are calling kind of ring vaccination. So you identify the most recent cases, and you vaccinate around those cases to contain the spread. And who do you vaccinate will be the contact of those cases. Now you have to define who are those contacts. No,
good.
those living in the household, those maybe in the schools, if the case was at school, maybe in prisons, in IDP camps, or in villages, small villages, then you would vaccinate all of them. So maybe something like at least the minimum 20 persons around the case to 200, or a village, if it's
Yeah,
smaller,
yeah.
could be entirely vaccinated.
So
And
that takes
yes,
me, 'cause I'm just conscious of time here. That takes me in a segue really to the sort of research that needs to happen to know where to target, firstly, but also the broad research that's going on now around the most effective way to prevent spread and the most effective way to bring about a vaccinations. Where are we at with research in this area?
excellent point, Michael. This is the time to indeed do research. Uh, use
Indeed.
the opportunity of this outbreak to just learn about this disease. We still have a lot of unknowns, including on the clinical characteristics, the dynamics of transmission. How do we get this disease spread so rapidly? The 1B, why is it? Um, uh, what are the complications, clinical complications of the case? And then, on the surveillance, the diagnostic tools that we have, are they good? Are they sensitive enough? And so on. There's a lot of cases that may not be Mpox, but there are also cases that could be missed, and because we are misled by, the diagnostic. And on the vaccines, as you said, a lot there to learn. Do we need 2 doses necessarily? To what extent 1 dose can be protective? What is the efficacy in children, because this vaccine has not been licensed for children, but we know that the population in Africa are young, and most of the cases are in young people and children. So we have to vaccinate them. So that's part of the investigational use of this vaccine. Then the impact. Yes, we got great impact after the MSM community were vaccinated, but is this going to be the case in endemic settings for Mpox? That's a big question. On the safety, yes, most of the side effects are mild, but we need to collect data, real time and so on and so forth.
Yeah.
So quite a lot of work. And WHO and Africa CDC are doing a great job in trying to do the response while also mounting research project and aligning those two so that we have the best data possible.
Jean-Marie, it's been absolutely fascinating. You've given us just a quick but very thorough insight in as far as we can to what Mpox is, how it relates to monkeypox, and why it is that Africa CDC is so concerned, why the World Health Organization has declared it a public health emergency of international significance. And I think we're going to learn a lot more about it. I do note there's a series of articles now in The Lancet that people might like to just Google and find, and that would give you even more insight to the extent of the spread of the disease and the sorts of actions that are now being taken to curtail that spread. There are always challenges in public health, and clearly, as you say, you've been working on them for about 50 years, give or take. So I really appreciate your sharing your understanding, your knowledge, and your insights.
Thanks so much, Michael, for having me. This is a disease that is of particular interest to me, obviously.
Yeah, obviously.
Thank you for the opportunity.
Thank you, Jean-Marie.
Yeah, bye-bye.